Hello everyone, I hope you're doing well. Today we will be going through the EDGAR study, which is an RC study. EDGAR stands for Emergency Data Gathering and ALPHASTROKE Refinement. The purpose of the study is to test a device that may be able to tell if someone is having a stroke. So first, in order to help us understand the study, let's go through some background information about strokes. So a stroke is an interruption of blood to an area within the brain, resulting in the loss of brain function. That interruption causes a decrease in oxygen to that area, and brain cells are very sensitive to lack of oxygen, and cells can start dying after around 5 minutes of no oxygen. But a decrease in oxygen can slowly lead to brain damage over the course of several hours. If the inadequate blood supply or ischemia to the area is resolved, function can be regained. But if the brain cells die or are injured, it results in prolonged or permanent neurological deficit. So there are two types of stroke, ischemic strokes and hemorrhagic strokes. The most common type of stroke is an ischemic stroke. These strokes occur when blood flow to a particular part of the brain is stopped by a blockage, such as a blood clot inside the blood vessel. The clot can form at the site of the blockage, or it can form in a remote area in the body and then travel to the brain. Ischemic strokes can be caused by atherosclerosis, a disorder where calcium and fat, like cholesterol, build up and form a plaque inside of blood vessels. And the other type of stroke is a hemorrhagic stroke. Hemorrhagic strokes occur as a result of bleeding in the brain. It is commonly caused when an aneurysm ruptures. And what an aneurysm is a swelling or enlargement of an arterial wall that results from defect or weakness in that wall. And not only does the bleeding cause interruption of blood flow, it can also cause compression of other vessels, preventing oxygenation. And patients with high blood pressure are at risk for hemorrhagic strokes. And there's also another disorder that has the same symptoms of a stroke, but whose symptoms resolve in less than 24 hours without treatment. This disorder is called a transient ischemic attack, and you'd see it in EMR as TSA. It can be caused by atherosclerosis or a small blood clot that resolves by itself. Okay, so depending on which area the interruption to blood flow occurs in, different stroke symptoms can manifest. Some examples of symptoms are facial drooping, sudden vision loss in one eye, difficulty swallowing, slurred speech, sudden and severe headache, dizziness, coma, and speech disorders. Stroke symptoms related to the muscles are oftentimes characterized by only occurring on one side of the body. And this is because the right hemisphere of the brain controls the left muscles and the left side of the brain controls the right muscles. So watch out in EMR for either left or right side weakness, paralysis, numbness, or loss of balance, but it could be both sides as well. Some medical terminology you might see in EMR to refer to stroke symptoms are bolded here. So we have hemiparesis, which is one-sided weakness, ataxia, which is loss of muscle control or coordination, dysarthria, which is slurred speech, and aphasia, which is a speech disorder, and it's the inability to produce or understand speech. And these symptoms may be temporary or permanent. If the blood flow supply is restored before brain cell injury or death, symptoms will resolve soon after. But if the inadequate blood supply leads to brain cell injury or death, then symptoms could be prolonged or permanent, which leads to chronic neurological deficit. Okay, so next we will go over the NIHSS, or the National Institute of Health Stroke Scale. The NIH Stroke Scale is a common diagnostic performed by a neurologist to quickly assess the severity of a stroke experienced by a patient. So essentially, the neurologist is seeing how many signs and symptoms of stroke a patient has. The more signs and symptoms, the higher the score, and the more widespread and or severe the damage is to the brain. So here is an example of how the speech ability is scored by the NIH stroke scale. So usually the neurologist will have a book with common images or scenes. They would ask the patient to describe the scene, name the items, or read sentences. Then they score based on the severity of the aphasia if it is present. Okay, so now that we have gone through some background medical information, let's move on to the study itself. The purpose of the EDGAR study is to test the efficacy of the ALPHASTROKE device in determining whether or not the patient is having a stroke, what type of stroke, and if it is a small or large vessel obstruction. The ALPHASTROKE device is a portable device that is painless, and it uses electrodes to gather information about brain activity. So this device would be particularly useful to EMS because in an ambulance there are no CT machines, and CT machines produce images of the brain. And so this device would allow EMS to gather more information about a stroke patient pre-hospital. Okay, so let's go over the inclusion criteria. All of the following inclusion criteria must be met for the patient to be enrolled in this study. And the criteria are acute neurological deficit defined as an NIHSS exam score greater than or equal to 2. The subject's neurologic deficit/symptoms have been present for less than or equal to 24 hours at the time of enrollment. And the subject either has been or will be evaluated with CT angiogram during his or her encounter with the emergency department, or has been diagnosed with a hemorrhage after receiving a non-contrast CT. Okay, so you all as MRAP research associates will be screening patients with a chief complaint of CVA, which stands for cerebral vascular accident, as well as imaging orders like CT head and CT angiogram on EMR. The notes in EMR will also tell you the last known well time, which again has to be within 24 hours of presentation. And you should also be screening for the NIH stroke scale exam score. Most of the time in the ED, a stroke patient will be announced over the PA as a stroke alert, and their ETA will be given. Then the research coordinator would typically have the MRAP research associate follow the stroke patient and medical team, including the neurologist performing the NIHSS exam to CT from the recess room. And this way you could quickly gather information about the last known well time, any prior neurological deficit, and the NIH stroke scale exam score. But sometimes the ED doctors may not have suspected a stroke upon presentation, but do later on in the visit. So then you would look for chief complaints of headache or weakness, and then check if they have received any CT head or angiogram orders. Okay, so now let's go over the exclusion criteria. And only one of the following have to be true to exclude a patient from this study. First one is under the age of 18. Second is currently pregnant, traumatic injury as cause of symptoms, convulsive seizures at the time of enrollment or as the cause of presentation to the ED, existing neurologic deficit/symptoms caused by previous strokes, and the last one is known history of any one of the listed chronic neurologic disorders. And that concludes the presentation on the EDGAR ALPHASTROKE study. I hope that was helpful to you all.